Teen Pregnancy in the U.S. and Niger by Vanessa. Statistics worldwide on teen pregnancy. Each year, 16 million girls between the ages of 15 and 19 give birth in the world. About 1 million girls give birth under the age of 15 each year. Pregnancy and childbirth are the second leading cause of death for girls in ages 15 to 19. 3 million girls ages 15 to 19 undergo unsafe abortions each year. The average global birth rate for ages 15 to 19 is 49 per 1,000 girls. Sub-Saharan Africa has the highest birth rate of 299 births per 1,000 girls ages 15 to 19. Demographics of the United States. The population of the United States is 325.1 million people. The United States is 3.8 million square miles. It is the third most populated country behind China and India. In the U.S., there is a birth every 8 seconds and a death every 12 seconds. In the U.S. According to the CDC, 229,715 babies were born from teen moms in 2015. Teen pregnancy rates dropped 8% from 2014. Maternal mortality rate is 17 per 100,000 live births. Infant mortality rate is 5.8 deaths per 1,000 live births. A mother's mean age at first birth is 26 years old. The low birth weight is 8.1%, and the premature baby rate is 9.6%. The life expectancy in the U.S. is 78 years old. Demographics of Niger. It is located in Western Africa with the bordering countries of Nigeria, Algeria, Mali, Chad, and Libya. Niger is 1.26 million square miles, which is about twice the size of Texas. It is in the desert, so it's dry and dusty with mostly hot weather. The population is 18.6 million people. Statistics in Niger. The infant mortality rate is 83 deaths per 1,000 live births, and that is very high considering the U.S. has a rate of 5.5 deaths per 1,000 live births. The maternal mortality rate is 553 deaths per 100,000 live births. A mother's mean age at first birth in Niger is 18. The life expectancy is 55. Niger has the highest total fertility rate in the world of 6.62. Their low birth weight babies is 27%. And preterm
Health
babies
concerns of teen
is about
pregnancy to a mother.
830,000. A teen who becomes pregnant has a higher risk for anemia, a higher risk for high blood pressure, and a higher risk for postpartum depression. These teens are also less likely to receive proper prenatal care and are less likely to receive secondary education. They are more likely to marry early on and are less likely to be financially stable throughout their lives. Health concerns of a teen pregnancy to the baby. These babies have higher risk to be premature. When babies are premature, they have an increased risk for death, an increased risk for breathing difficulties, and an increased risk for feeding problems. Also, these babies are at high risk for a low birth weight. This can cause respiratory distress syndrome, bleeding of the brain, which is called intraventricular hemorrhage, heart defects and heart disease later in life, intestinal problems, and possibly diabetes. Contraceptive use and family planning. In the United States, 82% of sexually active teen girls have used contraception at least once. 78% said they used contraception the first time. And of those 78%, 93 said they used it during their last sexual encounter. In the U.S., condoms, Plan B, and other contraceptives are accessible in stores and pharmacies near them. It is also easy access to other contraceptives such as the pill and the shot through their doctors, and these are possibly paid through their health insurance. In Niger, only 5% of couples had access and used contraception in 2006. This increased to 16% in 2010. But because it is so low and the population was increasing, the Ministry of Public Health created family planning services in 2012. And since then, 25% of women now use contraception in 2015. It is projected to reach 50% of women issues by the United 2020. States. Teen mothers usually receive less education. Unfortunately, more than 50% of teen moms do not finish high school, and only 2% of teen moms graduate from college. They are also at a higher risk of birth complications, where there is a higher chance of a maternal death and a higher chance for their babies to have health problems. Teen moms also have economic issues. Because they do not receive enough education for many jobs, it is hard to find a paying job to support for two people. It is also more of a struggle if they are not in a relationship. 8 out of 10 teen moms do not marry their child's father, and this also can have a problem with disapproval from many friends and family. Teen mom issues in Niger. Women are seen as inferior to men, and their opinions carry almost no weight in their marriage decisions. This leads to unwanted marriages early on, and in many cases, child marriage. The earliest a child marriage can happen is age 13, and the average age for one's first marriage in Niger is about 15.5 years old. Because women do not receive much education, if any at all, they are forced into a low economic status. Because of their low economic status, they are unable to pay for and receive the proper prenatal care they need. Because these women marry as a child, they are expected to have a child early on. This increases risk of maternal mortality if they are pregnant before the age of 18. Also, because of their low economic status and small access to contraception, if they do not want their child, they have to resort to an unsafe abortion, which has a higher risk of death for the mothers. Issues because of teen pregnancy. In the U.S., most teen moms are subjected to poverty. This affects the economy and possibly unemployment. There is also an increased risk of depression within teen moms because of the struggle. Also, children of teen moms have a higher % chance of becoming a teen parent themselves, rather than kids who were born by older adults. There is also higher health costs in the U.S. since teen births have a higher chance of a preterm or low birth weight baby. The average cost of a preterm or low birth weight baby is $55,393. Niger has population issues due to the large number of births because women are starting so early. Niger has the highest total fertility rate in the world, and each woman in Niger has an average of 7 children per woman. Almost 70% of the population is under 25 years old, and 54% of the population is under 15 years old. Ethical consideration and action. In the United States, there is a government-funded service called Planned Parenthood. Planned Parenthood is the largest provider for sex education. It focuses on pregnancy prevention and STI prevention. Their services include STI testing and treatment, prenatal services, abortion, contraception-related services, and more. In Niger, there are upcoming and new family planning services. This is also funded by their government. These are happening to prevent unsafe abortions, to increase the use of contraception, and to offer other services such as abortion and prenatal care. Also, in Niger, organizations are going there to bring awareness to other nations in the world of the large rate of teen pregnancy and their low access to contraceptives. They are hoping to change this in the near future. These are also other references